All clear, code white. All clear, code white.
Our role is essentially to support two things: the shelter system in the housing first world, the community world, who works with people who don't have housing or at risk of losing housing, to better be able to navigate and access health and clinical resources for their clientele or their community members. And then another part of our work is a bit smaller part, is to do some direct service, including assessment and sort of rapport building and sort of helping to kind of bridge people towards those resources. So if people don't have any resources, we might get involved directly sometimes.
The uniqueness of kind of our roles through like building the relationship and having all those partner meetings is that we start to hear common like trends that's happening or maybe some gaps in services. From a social work lens, often thinking holistically about someone and thinking about systemically about the issues that are impacting folks and making sure that those types of things are taken into consideration, especially in a highly clinical world.
So in my work as in harm reduction and around people using substances, we designed most of the interventions for people who were trying to get sober in a way that made sense to the system, which reaffirmed our values and judgments about people who use drugs. And so a lot historically of our resources around people's substance use was not at all about where people were actually at. It was about who we wanted them to be.
You exist within that system to actually push back against it, so not being expected to just kind of go with the flow.
Go with the flow,
yeah.
Yes. Lots of times what's happening with folks without housing is it's an overwhelming situation, and so people feel overwhelmed and people back up and so we call it like stepping towards the crisis, stepping towards the person, staying with the situation. And so for me, doing what actually makes sense is like really trying to challenge all those layers of like assumptions and beliefs and values that have been sort of given to us that we participate in.
I love it because I am extremely passionate about like the systemic stuff and disrupting that and calling that out and naming it. But I also love being in community with people and just sitting around supporting folks.
When I am sitting in the room with another person and we are laughing and we're doing good work and we're figuring stuff out together, that's what matters to me, and that's what keeps me coming back, even when things are really hard. Something like that.
That's really nice.
Some nice thing like that.